Hey everyone and welcome. I am so thrilled you're joining me for today's explainer. We're diving into the absolute ultimate 2026 guide on navigating online doctor consultations right here in India. Look, healthcare is evolving incredibly fast, and figuring out how to get high-quality care straight from your smartphone or laptop, well, it's really no longer just a luxury, it's a complete necessity for you and your family. So we're going to unpack exactly how this whole ecosystem works, so you can walk away feeling totally confident about taking control of your digital health.
Okay, let's dive into this. At its very core, telehealth is the delivery of healthcare through digital communication. It allows patients to consult with actual, registered doctors, get medical guidance, and manage their care remotely, without having to physically travel to a clinic for every single minor concern. But here is what's absolutely crucial to understand right out of the gate. This isn't just a quick, casual FaceTime call with a buddy who happens to be a doctor. No way. This is a highly formalized, structured, and strictly regulated process. It's specifically designed to safely handle legitimate medical concerns, all from the comfort of your own living room.
Now, you might be wondering about the terminology, and we really need to clear up a super common misconception here. You'll often hear people toss around the words telehealth and telemedicine like they mean the exact same thing, but there's actually a pretty clear distinction. Think of telehealth as this massive, broad digital health umbrella. It includes the whole shebang: health tracking apps, remote patient monitoring devices, even digital medical education. Telemedicine, on the flip side, is the specific remote clinical doctor consultation. It's the actual diagnosis and treatment part. So while we all tend to just say telehealth in everyday conversation, when you're literally talking to a doctor online about a symptom, you're technically using telemedicine.
I want to anchor our discussion today with this really powerful concept from our source material. Telehealth is more than a video call. We have to bust the myth right now that online care is just a casual chat over a webcam. The technology, that just enables the communication. The actual medical consultation relies entirely on real clinical reasoning, thorough patient history taking, and deep professional medical judgment. Make no mistake, it is serious medicine. It's just being delivered in a different way. So here's our quick roadmap for today's explainer. We'll start by demystifying telehealth in India. Then we'll look at government and private platforms, take you inside a virtual consultation, discuss exactly when to use telehealth, and wrap up with the big ones: prescriptions, privacy, and preparation.
All right, let's jump straight into Section 1, Demystifying Telehealth in India.
Think back to the year 2020. That year was incredibly pivotal. And why does this matter so much? Because 2020 is when the Ministry of Health and Family Welfare officially issued the telemedicine practice guidelines for India. This completely proves that we're talking about a heavily regulated, legally recognized, and incredibly secure framework. When registered medical practitioners consult with you over video, audio, or text, they are operating under strict government guidelines. So, rest assured, this isn't the Wild West of the internet. It is a highly secure, professional medical environment.
Let's move on and see how this builds in Section 2, Government and Private Platforms.
Did you know that India actually runs some of the largest public telehealth programs in the entire world? It's phenomenal. First up is eSanjeevani. This is a massive, national telemedicine service, and it's completely free. Just to put the sheer scale of this into perspective, this platform has facilitated tens of millions of consultations. Then you have Telemanas, which is amazing because it offers free, totally confidential mental health and psychiatric support. You literally just dial the toll-free helpline 14416. And underpinning a lot of this magic is the Ayushman Bharat Digital Mission, or ABDM. That's the digital health framework that securely links up all your electronic health records. So bottom line, high quality, free, and secure care is available nationwide right now.
But wait, alongside those fantastic government programs, the private platforms out there perfectly complement the public sector. Take apps like medeasy, for example. They offer incredibly fast, same-day access to verified specialists across more than 30 different specialties. Plus, they bring in some really cool advanced tools like AI symptom checkers, they integrate home lab diagnostics where they literally come collect your sample at home, and they even offer 0% EMI financing for larger treatments. So whether you lean on the free national network or you want the all-in-one speed and convenience of a private app, your healthcare needs are completely covered.
Which brings us nicely to Section 3, Inside a Virtual Consultation. And this brilliantly illustrates what the patient journey actually looks like. It follows a rigorous, step-by-step clinical process. Step 1, you choose your doctor and share your basic info, past diagnoses and allergies. Step 2, identity and consent. Because yes, the doctor absolutely needs to know exactly who they're treating. Step 3, you describe your concern and answer specific clinical questions about your lifestyle and vitals.
And finally, step 4, you receive your medical advice, a clear care plan, and potentially a prescription or referral. It's logical, it's safe, and it's 100% clinical.
Now, a really common worry people have is, well, what can a doctor actually do if they can't physically touch me? Good question. First, they meticulously review any photographs and past medical reports you've uploaded. They assess your home vital readings, things like your temperature, blood pressure, or oxygen levels. But here's the real game changer. They provide crucial safety netting instructions. That means they tell you exactly which red flag warning signs mean you need to get urgent physical help. Ultimately, they use their clinical expertise to decide if remote management is okay or if going in person is safer. They brilliantly compensate for that lack of physical touch through careful, highly targeted questioning.
Let's shift gears slightly for Section 4, when to use telehealth.
So, what does this all mean for you in a practical sense? Well, there's a very stark contrast when it comes to treatment boundaries. Online care is absolutely fantastic for everyday things: colds, mild infections, allergies, skin concerns, basic digestive issues, and managing chronic conditions. However, we have to draw a hard line when it comes to in-person emergencies. If we're talking severe chest pain, difficulty breathing, a suspected stroke, uncontrolled bleeding, or serious physical injuries, no way. Online care is not for emergencies. If you or a loved one experience any of those critical situations, you must go to a physical hospital or call emergency services immediately. Think of telehealth as a powerful tool for non-emergency management, definitely not a replacement for the ER.
All right, let's head into our final highly actionable part, Section 5, Prescriptions, Privacy, and Preparation.
Can you get a prescription online? I really want to pause here for a second because I know for a fact this is the #1 question on everyone's mind. The short answer is yes, absolutely. But let's quickly dive into the specific nuances of digital pharmacy laws here in India.
So, the crucial point is that a registered medical practitioner can indeed issue a valid e-prescription, but only when it's clinically safe to do so. It's not automatic. It requires adequate patient information, a clear doctor ID, and proper registration details right there on the digital script. Plus, restricted medicines, think antibiotics, sedatives, or steroids, require a very careful medical evaluation. A doctor is literally legally bound to refuse prescribing those restricted drugs if they can't physically examine you or if they suspect it isn't safe. Once you do get that valid prescription, though, tools like SmartRx are amazing for helping you safely store and effortlessly refill those medications right from your phone.
Next up, we really have to talk about data privacy. I totally get it. Sharing sensitive medical info online can feel a bit daunting. And look, while no digital service on Earth is 100% risk-free, you can keep your data incredibly secure if you just follow some basic rules. Always verify that the platform is HIPAA compliant and has transparent privacy policies. medeasy is a great example of this. Make sure you leverage the ABDM for consent-based, encrypted data exchange. Always use a private internet connection. Please, whatever you do, do not consult a doctor over public Wi-Fi at your local coffee shop. And finally, never share your prescriptions or consultation screenshots publicly on social media. Keeping your digital health private is very much in your hands.
Okay, if you're gonna take a mental note, or literally grab a screenshot right now, make it this one. This right here is your ultimate preparation checklist. Before you ever click connect for that appointment, just take a minute to write down a clear timeline of your symptoms. Keep your previous prescriptions and any lab reports right next to you so you aren't scrambling around looking for them during the call. Jot down any home measurements you've taken, like your blood pressure. And above all else, be completely honest with the doctor. Don't leave out symptoms just because you think they're embarrassing or you assume they aren't related. Following this simple checklist is going to empower you to perfectly prepare for a super effective virtual visit.
Well, we've covered the government platforms, the clinical rules, the safety protocols, and exactly how to prepare for your visit. So I want to leave you today with this final, really important question. How will mastering digital healthcare change your family's medical future? Because, you see, telehealth isn't just a backup plan for when you can't travel anymore. It is a remarkably powerful, everyday tool for proactive health management. By understanding how to use it safely, you're unlocking a whole new level of accessible care for yourself and your loved ones. Thank you so much for joining me on this explainer today. Keep learning, stay proactive, and here's to a much healthier, more connected future for all of us. Catch you next time.